Hey, how are ya?
I'm good. How are you?
Good.
It was good there, girl.
Hey, look, right?
Yeah, you.
It's nice out.
Hi. Are you not checked in yet? You have to do this.
Oh wait, I gotta check here.
And then you can see
What do I do?
Tap that.
Yeah.
So now you can see yourself. So now you gotta adjust that. Here's you.
Yeah.
Adjust that so you can see yourself.
Oh.
And then you go more right.
Okay.
And then if you go to the gallery view, there's a button. Hi. There's a button.
Megan, can you hear me?
I can.
All right, good deal. Let me just get some audio or video up in here real quick. I've been
This is
blanking myself out on all the other webinars I'm on. Oh, nice. Here we
I
go.
told you we'd have to have some fun with it, right?
That's awesome. I love it. Who's that? Who is
He
it?
doesn't have a name yet.
Oh, really?
Yeah.
How long do you wait?
When we have like 20 of them in like a week and a half.
How long do you wait to name them?
When we figure it out.
God, that quick?
Yeah.
Jeez.
Oh, I've got like 20 more coming in a week and a half. So yeah.
Holy heck. What, just being born right there on site?
Yeah.
Wow. Just a world I am not familiar with at all. That's awesome.
Okay, I don't know these people. I
see Baker in there.
Uh-huh. And Kyle.
Kyle, what's up, guys? How we doing?
Hey, we're good, man. This is Connor, my little man.
Hey, Connor.
Say hi, everybody.
Holy heck. Connor, what's up, bud?
Hey.
Let me see who else is on real quick. I know I got about, it said I had over 115 views on this blog post. So
Nice.
Hey, Olivia.
they start rattling in.
My Zoom thing.
I know.
Huh?
No. I mean, you can if it's on the chat line.
What?
No.
No, I think I'm muted. I don't know.
Yep. Okay. All right. Thanks. All right. Thanks. Bye.
$300 from
That's actually my team member who's going to be helping out with any questions that are on the chat line today. So that's Noah.
Oh, okay, cool.
They basically don't have to pay the photo. That's our supply person. So you don't have to pay our thing for this month then?
This is $300 for premium.
Oh. Forever? Or just temporarily?
The whole con. I don't think it's not due yet. Our homeowner.
I don't know, I just knew I saw something from them.
They're just taking off auto because of nobody's really driving. Yeah, who's it?
Yeah, they had a commercial about it.
Megan, you want to just let's give 3 more minutes and then we'll start at 3 and people can still trickle in.
Absolutely. Yep. I've got 2:57 right now.
Going,
So
right?
we'll start right up at 3.
All right, good deal.
I have no idea. I never used Zoom for CE.
Are you going to want everyone to mute their lines and stuff when you get started while you share your screen? Okay.
Yep. Oh, nice, Kyle. Kyle's got the dog on.
Oh my gosh, you have a goat.
I do have a goat. I was gonna joke around and be like, have you guys seen the NBC thing, the NBC News thing, where like you can rent a llama or a goat for like $200 to like join the Zoom call? So Matt said no expenses should be considered. So we're doing this all out. So we're doing the expensive version here. We've got one in my lap, and if you guys can see behind, I've got about 60 more back there. So,
Oh my God.
yeah. So there's goats, there's pigs, there's chickens. You know what I mean? So yeah, we went all out for you guys.
Wow. Spared no expense, Megan. Thank you.
Absolutely. All right, guys, we'll give it another minute and then we'll get started. But thanks everybody for joining so far.
Do you have how many are you seeing that's on, or is there a number count?
17.
3, 6, 9, 12, 13.
Oh, it says there's 18.
Okay. Yes, I might not be showing up on video. Thank you.
Oh, there we go. Gotcha. And you're going to keep the chat feature live, or how are you going to do that? We're just going to do informal Q&A afterwards?
We'll do a little bit of both. So what we'll do
that?
is I'm going to go ahead and share my screen in just a minute. And then I've got one of my team members on. His name is Noah. So if you guys want to ask questions that like as we go, Noah can go ahead and answer those on the chat line. And then we will also do just a general session of Q&A. Behind me that you can see, I do have some of our products, whether it's, hand pieces or any guys have questions on infection prevention in general. I've got those as well. And I do have a few things up that if we need to, I can certainly grab those as we go too. So, all right. So let me go ahead and let's see, close that out. All right. So everybody, like I said, thank you to Matt. We wouldn't be here without him today. So we're going to go over infection prevention, and let me bring this down for just a second and get the correct PowerPoint up. All right. So yeah, I know you'll probably hear lots of random farm noises as we go. So, all right. So again, so today we are going to talk about aerosol reduction because that is obviously a huge topic of the moment right now. So again, hope everybody is safe and secure out there. So we're going to go over today one of the things that Dentsply Sirona has to offer, as well as some competition, just so you have a better idea of everything that's on the market, what you should be looking for, and then why aerosol reduction in general is just important. So that's what we're going to do. Again, kind of overall oral evacuation, the differences between high speed, low speed, because it's just not something that we've really talked in depth about before. Some of you, I know I have done my infection prevention lunches for, and this has either been brought up. I had a doctor call me yesterday. He's like, oh yeah, I think I remember you bringing that in, but it wasn't ever like a big topic of discussion because aerosols were not as prevalent and then need to reduce them as of right now. So we'll kind of go talk about that a little bit. One of the big things that we've been discussing on the Dentsply side is really layering of protection procedures or layering of protective options. So aerosol reduction is just one of those layers. So we're going to talk about just, again, within that, obviously it's just a portion of aerosol reduction. We still have to have proper protection equipment. There's been lots of discussion about, are they going to make N95 mask mandatory? They haven't come out yet. They've made some recommendations. What pre and post procedural rinses are going to be and HVE, and what actually is considered HVE, because that's a big thing too. There are some other products in the market, and we'll talk about that, but what actually constitutes an actual true HVE system. So what right now is the recommendation, and I've talked to Matt already, and the two products that will help out with this he does have and he can offer you. So right now ADA and CDC are recommending only hydrogen peroxide, and the recommendation from ADA is a 1.5% concentration, and that's going to be a 60-second rinse, and that's not just like a gargle. That's a true rinse itself before and after each procedure. So the two products that Matt has that he can offer is going to be the Listerine mouthwash, and then as well as the Colgate Proxil. If you were to buy like the hydrogen peroxide over the counter, that is at 3%. So you would actually need to mix that 2 parts water to 1 part of the hydrogen peroxide. So that's going to help out with just to help reduce some of the bacteria levels that are in the, that are in the aerosol cloud that we are kind of like working in every day. So that's just kind of an overview. Again, that's going to be your first layer of protection, if you will, if we're talking about layering protection. So we've all seen, if not, believe me, it is well worth the 7 minutes on YouTube, the movie If Saliva Were Red. The cloud that we live in before this was an 8-foot, or it still is an 8-foot diameter of aerosol once you kind of get into the nitty gritty. And we'll look at the studies there too. But we really forget that saliva is clear. So before it was like, oh, it's out of sight, out of mind. Now everybody's a little bit more cognizant about it. But I always like to kind of reference this video because it is so telling. I know it's very dramatic and we're not picking up phones and handing paper charts anymore, but it's always a good reminder of why we're doing the steps that we are doing. So there's lots of different studies out there talking about aerosols and splatters, what's going on, how you can control them, and that's what we're going to be talking about today. But there is a ton of information out there. Again, the differences between low speed or saliva ejector, LVE, and high speed. Saliva ejectors are meant for moisture control only, okay? So if you have a hygienist that is doing, a cavitron or an ultrasonic procedure of some sort, and they are using a saliva ejector only, the only thing they are doing is moisture control. They're not doing anything for aerosol reduction, okay? So that's why I wanted to make sure that we are real particular, real clear on the differences of what a saliva ejector or low speed does, only moisture control, versus HV, which is going to be your aerosol reduction, okay? So this is nothing new. Again, this is nothing new that I've been talking about it in my wonderful IP CDC guideline. You guys, I'm sure a lot of you have seen me come around with my wonderful CDC booklet, right? Talking about what needs to happen. And obviously CDC is what Pennsylvania State Board uses as their recommending guidelines and state laws as well. So one of those things has always been, if there is an aerosol procedure going on, an HVE should be used. Again, because we have such a risk factor there, especially for hygienists, because they are usually working alone. And so they're only using that saliva ejector. So that's why we need to really talk about this today. Again, kind of talked about that 0% reduction, the saliva ejector. It's still going to have a place in the hygiene world, absolutely, because again, your aerosol is going to be reduced by HV. Your moisture control is still going to be used with your saliva ejector. So nothing's going to change there. They can still hook it and bend it and have that in the patient's mouth. That's still going to be there, no problems at all. And that's usually, I think the last report I looked at, it's like 73% of hygienists only use saliva ejector, and that's it. But again, it's only for moisture control. So the area, again, is an 8-foot cloud, and bacteria levels can be increased 5 times during an actual treatment. That's high-speed handpieces, that's your ultrasonics. I've already had a couple offices between the last 3 days that have called and said, we're just not using ultrasonics when we go back to work, which I think is kind of the same as going, okay, well then you shouldn't be using a high-speed handpiece. Like, it doesn't make any sense. You don't want to start, offering subpar, clinical benefits just because of an aerosol cloud that we are already reducing, and we can show you ways to do that. So to be considered a true HVE, according to the Molinari study, and happy to email this out to you guys, not a problem, it has to have an 8mm opening, and it needs to be able to remove 100 cubic feet per minute of air, basically move that air. So in order to be able to be considered a true HVE system, even though some systems on the market now, you plug into the HVE, it's not actually considered a high volume evacuation. So to be considered high volume, again, has to be reduction of aerosols by 90%, has to have an 8mm opening or an 8mm bore, and it has to be able to remove 100 cubic feet per minute. of the air that's, the air that with all the aerosols that are involved. So right now, this is what I kind of like to talk about with right now what's going on in a dental op versus a hygiene op. So in a dental op, you have the dentist and the assistant. So a dentist and assistant with your existing HVE, you are reducing between 90 and 95% of aerosols, okay? So that has still been, that's a huge number. So 90 to 95% of aerosol reductions already being performed in in a dental laboratory. Now, if you have an EFTA that works by themselves, that type of thing, and they aren't able to do that, obviously that's going to be reduced. Or a hygienist that is not using that, they're only using saliva ejectors. That's really what we're looking at today as far as some of the products that are on the market to help that out. Okay, so with your standard high speed, the reason that hygienists just don't want to use it is because it's really heavy. It's a pain in the butt to work with. They're using usually you're using their non-dominant hand to try to work this out. It's very, very cumbersome. It's constant sucking up the cheek or the tongue or whatever, and it's just not real comfortable. I will say more and more schools are teaching at least how to use it because it is the CDC recommendation. But as soon as they leave school, they're like, nope, forget it. But at least it is being taught. But it is just not something that's very comfortable or ergonomic as an option for the hygienist. So what we have and what I'm going to show you actually visually, we'll see it on the screen as well, is the PureBack HVE. So I'm going to grab this over here. But this itself is the actual suction tip, mirror head, whatever you want to call that. That is that new, system for that hygienist. And then this is actually something that goes directly into this little plastic piece here, goes directly into your existing HVE setup. So instead of putting the HVE tip in there, you would put this in your spot, and now you have a brand new hose. Okay, and I really can't kind of go over how much lighter this hose is unless you can actually feel that for yourself, but it is 69% lighter than an existing hose itself. So the ergonomic issue is pretty much negated right there. It's a ton more flexible than your existing hoses as well, but it's made of on the external the same exact material. So you're still able to wipe it down. That's not going to change. Nothing there is changing at all. And then actually where the portion goes in that you actually put your mirror in, there is a swivel. So you can actually swivel around this throughout your procedures and help out with that ergonomics as well. So the ergonomic benefit is truly in the hose itself. And then again, you still have your autoclavable piece as far as, the mirror head, and then the actual suction device. So again, this is truly considered a high-speed evacuation system. So this is going to then, again, just go into your existing suction device, and then you would just have a new hose that's replaced out. You would clean this the same way. You would run your lines and things like that, which we'll talk about. So it's not really that difficult. Obviously, you don't need to have a service tech come in. I always kind of call it a plug and play. You just put it in your suction and you're ready to go. It's very, very simple. So we'll talk about that a little bit. I don't know if I can get this to play or not. Yeah. So I wanted to kind of show you this, which is a small little video. You get it? Yeah, go ahead and do a little bit more and then you can turn that. There you go. That's awesome. Okay, so a picture is worth 1,000 words, right? At the end of this, there are YouTube links. I'm happy to email you out if you want to see them, but I think that kind of shows you a lot of what's going on. Again, all of that is aerosol. So before, that was not being captured at all with a saliva ejector, because a saliva ejector, again, 0% reduction versus an HVE, which is your 90% with PureBack. Okay. So again, this is just kind of going over all the little things that we'd already talked about. So I have all the slides if you want them. Happy to go ahead and get you that information out as well. Obviously, cost is a factor. This is something that, and Matt, I'm not sure what your costs are, but it's $199 retail, okay? And what that comes with is actually, so the kit itself to get you started is the hose, the little adapter piece, and then it's gonna come with 3 of the mirror heads. So that is what is in your kit, okay? The mirror heads themselves, they are used up to 100 times. The only thing we say is that they can be used longer than that. But more than likely your mirror is going to be scratched up, I'm sure, by then. You throw this in the ultrasonic and the autoclave. You can get just the mirrors by themselves as well, so you don't have to replace anything else out. So even if you only get the bare minimum of 100 uses out of this before you have to chuck it, it's 20 cents a use, okay? So if you boil it down, it's really, really inexpensive for that type of protection, okay? All right, so increased respiratory safety, obviously we've talked about that enough with the COVID-19. I'm sure everybody on here has been through enough webinars and things like that. I will say though, one of the big things with this mirror head itself, the shape of this, it allows so you're not digging into any soft tissue and causing discomfort. So that has been a nice little kind of added benefit because it's a mirror head. So it definitely has a little bit nicer of a feel than
Mommy has to work.
What's that? Oh, somebody came in.
You're good.
All right. So this just kind of goes over everything I just talked about, your 100 cycles. You will get more 100 cycles than that, again, unless your mirror head gets too scratched. I will say one of the tips that I would use is when you do get this in, is to go ahead and take a fine or medium prophy paste and just kind of roughen up the surface a little bit, so that way the droplets don't stick on the actual mirror. And you just get a better kind of like Rain-X for your windshield. So you just kind of roughen up the surface a little bit and makes a big difference. That's the adapter. We already talked about that. The piece that we actually do have, this little piece that does come off if you wanted to. If you really want to get down in there and clean, you're more than welcome to. Not a problem there. Now, let's talk about, let's get it all out there. Let's talk about what is going to be the issues, why people don't like them. It's kind of like, I will make fun of myself here because I'm literally sitting here talking to you on a goat farm, so I feel like I have that capabilities to do so. I loved my BlackBerry. I was a huge BlackBerry user. I did not want to give it up. I was like, I am not going to this new iPhone thing. There's no way. It was a pain for me to really give up that BlackBerry, right? So, but then as soon as I went from that BlackBerry to that iPhone, I was like, wow, this actually does make a big difference. It makes my job a little bit easier, and obviously now I'm an iPhone user, right? So that's where we kind of come into play with this. It is going to be something different. I'm going to make fun of you, Matt, and it's kind of like wearing a seatbelt when you don't want to, right? It's just getting out of your comfort zone. Everybody has something that they can use as that analogy, right? So it's going to be different. It's going to be something that you have to get used to in the beginning. Is it going to be complete moisture control? No. Again, you're going to want to go ahead and use that saliva ejector for moisture, because if you're working in the maxillary, you're going to have pooling. So you're still going to want to use that saliva ejector. This is not the end all be all as far as moisture control. Again, this is for aerosol reduction, okay? So we do actually have really cool positioning guides. I think this is at least a nice little helpful hint, a nice little helpful guide, but every clinician's going to get their comfort level their own way. So I have no problem, I'll pass this out and I'll make sure that Matt can email this to everybody. But yeah, this is something that you can certainly use to kind of get you started. There's a lot of YouTube videos
looks like a
as
dildo.
well on positioning.
You're muted.
If you guys don't mind muting your lines, that'd be great.
Oops.
Thank you. All right,
Good
so
Lord.
I can certainly help out with that, making sure that everybody has a positioning guide. All right, so insulation, I kind of already went over that. It's super easy. This is just kind of giving you some pictures instead of my wonderful live demo here. Since I do not have a suction device in my backyard in the goat farm, this is just what it's going to look like in your operatory. So you can see, again, it's plug and play. You're literally going to put that right down in your suction. You're going to turn on and off your suction the same exact way that you've always have in the past. There are two ways, because we always had to give a manual as well as an automatic way to go ahead and take care of the actual mirror head itself. most offices are just going to go ahead and throw this in the ultrasonic. Go ahead and use your manufacturer's instructions on how long it needs to be in the ultrasonic, and then go ahead, rinse, bag, just like you would anything else. As far as the actual hose itself, you're more than welcome to use your wipes. I've got a nice little case of Volo wipes right here. You can use your Volo wipes or whatever else that you use. And then at the end of the day, you are able to run your suction cleaner through the hose just like you would any other of your existing hoses as well. So we have our PureVac buckets. It will fit right inside of the PureVac bucket as well. All right. So let's look at competition, but I am going to go ahead and open it up. Does anybody have questions they want to ask about PureVac HVE right now before we look at some of the other options on the market?
Now you can unmute your line. Yeah.
Heather, do you have a question?
Oh, yeah. So you were saying that we, so when you're using that with your non-dominant, if I typically would hang my suction, would I still hang my suction, but then just use that at my Cavitron as well then, correct?
Yep, you got it. So instead of like right now, you use a mirror, right, with your non-dominant hand.
Oh,
This is what,
yeah.
yeah.
Okay.
Yep, you got it. So this is going to be replacing your mirror and give you suction at the same time.
Okay.
Make sense?
That just making sure that.
Yep,
that's what
absolutely.
said.
Yep,
Just
you got it. So
making
hang
sure.
your
Okay.
hang your saliva ejector and then just use this as you would with your mirror, but now you actually have suction with it too.
Okay.
Yep.
All right. Thank you.
Sure. Anybody else have questions?
Megan, I do have a question.
Sure, absolutely.
I know when you have both of those on at the same time, it really kind of cuts down on the power of both. Are we going to run into that with this?
It's going to honestly depend on how the office is set up and how many clinicians are using it at the same time. You know, whether it's regular suction, whether it's this, and that's going to basically go back to your, your suction and your vacuum requirements, and see what it's going to be like. And we're already hearing that, like, we may have to. There's some offices that usually when an office is built out, they look at the vacuum requirements per clinician, and hygienists in the past have only been considered a half of a clinician, if that makes sense, because they're usually only using saliva ejectors. So we don't see it being a huge issue, but there are some offices that may have like really old ones that are already like on their last leg that they may need to upgrade at some point.
Got it. Thanks.
Sure.
That's super interesting because I actually used it. I graduated Hack last year. So at Hack we had it.
Yep.
I seemed to really like it there, which they probably were set up for us to always use HVE because in school, of course, you always are. And then my next office I went to, it was just absolutely horrible. They ended up in closets.
Because
And
the suction wasn't enough.
yeah, and that's I work with Brittany, who was just talking, and we were discussing it. And it's not that I didn't necessarily like the product. I really liked it for the retraction. I thought it was nice, unlike the lower anteriors where you didn't have to have your mirror and a suction in there.
Yeah.
My concern was just the power.
The power
But that
itself,
makes
yeah.
sense then. It was an older building, and it probably wasn't set up to really use it that
Yep,
well.
and that's exactly right. It's probably just because of the suction itself. So that's something that offices will need to look at. But yeah, it's meant to do your 90% reduction, and your saliva ejector will do your moisture control. Yep. All right, so let's look at some of the other stuff, because one of my big things is let's just put everything out there and we'll go from there. Obviously, noise is a huge concern, as well as the suction itself. Noise, obviously, just for your patient comfort level. So we are a lot quieter than a lot of the other things on the market. And then you can see the actual suction comparison on that page on the left. So I know that, Matt, we talked a little bit earlier, and you had a customer looking at Blue Boa. And we'll talk about Blue Boa, but it's a 515% greater suction than Blue Boa. So again, Blue Boa is considered even though it goes into your HVE, it is not considered an actual HVE. It's more along the lines of an LVE at that point. So, yep. So this is just kind of a greater comparison as far as noise is concerned, and things like that. So let's just kind of look at some of those things. So relief, obviously, that is something that does go into your high-speed suction. It hooks right there on, like, inside the patient's mouth. But again, it does not, it does definitely shrink that bore size, so it's not able to do that 8 millimeter bore. So you're looking at more moisture control. And actually, even when I was on the Blue Boa website, they don't even claim anything about aerosol reduction. It's only moisture control. So they don't claim that they can help out because, again, essentially it's an LVE at that point. So they don't claim that they can help out with aerosol reduction at all. And that's on their website. So you're more than welcome to go there as well. So let's look at some of the bigger things out there, right? So we have Isolate, and Isolate actually has 3 different products on the market. So Isolate itself, if you look at that, like the grayish piece, if you will, it comes with 3 of those. It's a pretty expensive product. And 3 of those, you do have to go ahead and autoclave that piece out. And then you have a disposable piece as well. So Isolate and Dry Shield, there's a $2.50 to $2.70 disposable piece of that. And then it's about $1,000 or so to kind of get started. And then if you want additional of the autoclavable pieces, you have to work with that too. And this might be awesome in an operative situation, but for a hygienist, this is really limiting as far as how many teeth you can do. The other thing is just patient compliance. You really need to have a patient that is okay, that doesn't have like claustrophobia issues, that can breathe through their nose, things like that. So each one of those have their concerns. I'm not saying it's not a great product. It is. It definitely helps out. If a clinician is like by themselves or doing 2-handed dentistry versus 4-handed dentistry, it definitely serves a place. But that's just kind of what is out there on the market as far as bigger options are concerned. Okay. And let's look at extraoral systems. Okay. So again, we're talking about layering PPE, right? So we're talking about layering PPE, then we're talking about post and pre-surgical rinses, and we're talking about aerosol reduction. There are lots of information right now. ADS is doing a pretty good job of getting their product out there. And absolutely, they're more than welcome to do so. This is something that is extraoral, right? So we still have to have something intraoral. So one of the products that we talked about is still going to be used. Your extraoral system is going to do just that. It only removes that extraoral. So if we're looking at PureVac HVE doing a 90% production or reduction rate, that's going to be your last 10%. Okay, or if it's a 90 to 95 with your true HVE, an assistant, that's what's going to be your last, 0 to 9%. They're claiming 99% reduction rates. The other thing, just to kind of, again, just information for you guys to have, is those are filters that need to be replaced out of there. So about every 6 to 12 months, it's about $320 on the 3 different filters. And I told Matt I was gonna like make fun of you guys. I'm like, I can't even get you to change a water filter on a Cavitron. But so these are, filters that do need to be replaced out. Do I think that there's a purpose for this? Absolutely. I think for patients, I think the visual effect of this is wonderful. Do I think it's financially feasible for every office to have one? Probably not. I also think there's some space limitations on there as well. But just wanted to give you some information. The other product on the right-hand side is called Vanny Gold. And sorry, Matt, I think that's something that you can order on, like it's a direct company, but just to give you an option as far as 2 different ones. I know that they are already, like the Vanny Gold, they're definitely saying that we're way best in production. The ADS system right now, they are looking at, if you have already placed your order as of right now, or that was as far as like Friday afternoon or Monday morning, they're looking at late July to beginning of August as far as actually getting that. And that's already if you have already placed your order. So let's talk about that. Let's bring it out as far as just, what's going on in the market in general. We literally went through 2 years of supply in 5 days of our own PureVac product. Okay. We were going through like 100 a month, you know what I mean? Something like that. And we went through that. Like I said, we went through 2 years. So I know, Matt, we put in an order, or Shine put in an order, and hopefully that we'll get those out to you. But this is going to be something that's going to be on and off back order as we can get them. The nice thing is that we are not on back order as far as the raw materials are concerned. And as far as our company, obviously, like everybody else, we've had some furloughs, things like that. So we're working on getting those people back in and being able to manufacture as soon as possible. So my thing I would say is that it is a first come, first serve. So if this is something that you're looking at for $200, it's not going to make or break you, right? So the sooner that you order something, the better, and the sooner that you will have it in your office. Okay. At one point there was a 2+1, but because of supply and demand, they took that 2+1 offer off the market. But just know that we are making them, and we hopefully, again, just kind of bear with us. But I think that's going to be across the board, no matter what company that you're working with. Hopefully it's not going to be that August, July frame as ADS, but yeah, the sooner that you can get that orders in, the sooner that they'll actually be able to be into your practice as well. Okay. All right, so where do we go from here? We are looking at lots of, obviously, hygienists that are very concerned about, equipment and things. So hopefully this will help out with that. We do not want to see, again, subpar dentistry being offered just to do hand scaling, because technically, even if you're using that low speed handpiece, you're still providing splatter. So still an HVE has to be used even when doing just your rubber cup polishing, okay? So again, it's all about kind of like that layering thing, right? So also just to kind of ease your fears that yes, Purebec HVE is ADA, FDA, CDC compliant. It all has the letters of approvals on there as well. It is a nice little thing that you can also talk to your patients about when they come back for visits and say, hey, this is something that we're doing aerosol reduction that we haven't done before. This is, you can really have that conversation, because I am sure that patients are going to have a ton of questions. If you guys want that little video or YouTube links to put on your office Facebook pages or, on your websites, I'm happy to give that to you as well. So you can literally say, hey, this is what we're doing to help ease your fears and to help with aerosol reduction when you come back in. So that way we do have a safe environment for you to go ahead and schedule your procedures with. Again, these are some of the video resources that, again, I mentioned, so we'll talk about that as well. And now I'd like to just kind of open it up and do have some questions as far as anything IP related. My manager, I think, is on here, I think still as well. He's awesome. He actually worked on the Sultan division for like 20 years before we kind of merged with them over the Dentsply Sirona. So he's got a lot more knowledge than I do as well. So between some of our heads put together, we'll happily answer anything. And then after we do this, I also have some additional resources that Dentsply is offering in the near future I wanted to bring up as well. So I'll open it up on the floor and see how you guys have any questions for us.
I have a question.
Yeah, go for it. And now you froze, Matt. There you go. Matt, you turned your mic off. There you go.
All right. So you're saying 90% on the Purebec. That's cool. The other 10%, theoretically, by the ADS is a machine. And like you said, that's not going to be for everyone.
It's not.
Is the CDC requiring that, recommending it?
No,
what's
not
the future look like as far as having to have one of those?
The only thing that CDC is requiring or recommending, however you want to talk about that. So CDC is your guidelines. Pennsylvania then uses CDC as your regulations, right? So there is in there saying that if you are using, any type of aerosolization procedure, that HVE needs to be used. So again, and then that true HVE is then dictated by the Molinari study. So you need to have something that has that 8 millimeter bore, reduced 90%, and then that can move that 100 cubic feet per minute. So, but yeah, as far as extra oil, nothing yet. I can't say that guidelines aren't going to be changing as they are. I mean, maybe some of you saw the ADA mask. They have like an interim mask recommendation now, right? So I can't say that's going to be the same thing tomorrow. You know what I mean? So as of right now, it is intraoral, needs to have HVE done.
Okay, thanks.
Sure. All right, so any other questions, make sure you unmute yourself, Matt, and then go ahead and ask those. And then if not, I'm gonna go ahead and put this down. So if you want to screenshot this one, take a picture of this, that's totally fine. So Dentsply is very focused on healthy practices and makes healthy smiles, right? So what we have is a website, and we do have lots of CE on there. They are free. This is all the Here For You is a website basically devoted to topics that are going on right now. Now, don't quote me on the May 6th and May 13th dates yet. We are making sure that we can certainly get that. And I will have that information over to Matt. As far as hopefully that May 6th, it will be that week though, it's literally going to be by Dr. Marie Fluent, who she works with OSAP. And it's going to be, the topic is how to get your office ready and how to ensure infection prevention compliance. So I know that we have done over 100,000 CEs or CE clinicians join our website in just the last 6 weeks. We are only able to do 1,500, so make sure that you get on as soon as you can to sign up. We will have recorded webinars on there, but this is actually going to be one that's live. And then the following week, we're also going to do one on ultrasonic unit, obviously, and dental aerosol. So if there's any other questions, and she'll go a lot more scientific than I did as far as aerosol reduction and bacteria that's in the air and things like that. So those are 2 webinars that we will have coming up pretty soon. And those are gonna be live. So it's nice to be able to ask questions on chat lines and things like that. I know I was on one that Marie put on about 3 weeks ago now, and she was on there for another 45 minutes to an hour just answering questions. So they were great. I mean, she'll stay on there and answer as many questions as you have. So I just wanted to give you that heads up. And also, once we get back into the practice, let me know if I can help out with anything IP related, CDC stuff, information. You know, if you wanted to do virtual calls like this just for your office before we go back in, I'm happy to do so as well. If you wanted to go over the CDC guidelines and what has changed just since 2000 and, you know, when they came up with the summary in 2016, I'm happy to do that. Whatever I can, you know, whatever I can do to help, just let me know. So just go ahead and screenshot that one, take a picture of the screen, whatever you want to do there. Obviously, Matt always has my information, so he can get in touch with me too. But I just wanted to say thank you guys so much, and I will certainly keep the chat line open for a minute or two if you have any other questions.
I have another one since no one else. I'm not trying to.
Nobody wants it. Like I was at least figuring I would have questions on like more goat stuff. No. Go for it, Matt.
Well, that's my. And so you're, you know.
Hold on, you're breaking up.
What are you? Ah, crap. Can you hear me?
I can now.
What are you hearing? You talked more up.
Go ahead and either text. Yeah, I still can't hear you. I was say you want to text me, or I can see if I can open up the chat line.
I'll text you.
Okay.
Shit. All right. Oh, that's why. Is anyone else talking or no?
I can hear you, but it's like it's real choppy.
All right. I got 2% on my power left. That's why I'm having a hard time here. I think my best. So if you want to wrap it up, and then I can field questions and shoot them your way afterwards, that'll be fine.
Absolutely. And I brought up the group chat now. Can I rewatch this? I did actually record this, so I will figure out how to upload it, and then we'll go from there. Yep. But I'm like a Zoom newbie, so bear with me. But yeah, I'll figure that out. So give me a day or two, but I'll happily do that. All right, guys. Thank you guys so much for watching. And of course, I've got the baby actually just came back to say hello. So we will say goodbye on our end, and stay safe. And again, anybody that needs anything, just give us a holler.
Thanks, Megan.
You're welcome. Bye, guys.
See ya.